Good evening, everyone.
Good evening.
Welcome to
Good
the Social
evening.
Service Committee of August the 29th. Boy, it makes you think it's almost the end of summer. So the first item on the agenda is approving the previous minutes.
So,
It's been moved and it's second, all in favor?
Aye.
Any opposition? Hearing none. Okay, unanimous. Oh, I see Mr. Bullock's done it. Doug, do you have a copy of the agenda?
yes, yes.
Okay, then.
Yes, thank you.
Okay, number one, Albany County Nursing Home is on tonight for authorizing the county executive to execute the necessary documents to participate in the Interlear Group Purchasing Organization, Interlear.
Thank you.
Thank you.
Larry could not be here tonight. He apologizes. He
Thank
was
you.
able to get on vacation after his health department survey
Good news there.
2 weeks ago, or week commenced 2 weeks ago. So asked me to come in here and request be able to participate in this group purchasing organization. It's at no cost to the county. It gives preferential pricing to him if they want to buy off of them, and it's optional to buy off of their grouping. So.
Do I hear any questions or concerns from the legislators?
What
Hear motion.
products are they gonna buy?
Motion's made. Did I hear something? Doug, you have a question?
Yes.
What's the question?
They have many varieties of it. Could be medical equipment, can be medical supplies. There are some food options also.
Food equipment,
Yeah,
okay.
some dry goods and whatnot,
So they'd get a discount, of
on whatever it is.
whatever it is, okay?
Yeah.
From probably group buying,
Yeah.
right? Okay. Thank you.
All right, any more questions? You prepared to vote? I hear a motion.
So move.
Motion's made and been second, all in favor.
Aye.
Any opposition? Hearing none, it's unanimous. Thanks a lot. Nursing home is doing well, thanks. Oh, we have coming up, Michelle McLean, Albany County Department of Social Services here. Commissioner number 2, authorizing agreement with the Community Maternity Service regarding the maternity shelters and support services.
Yes, we're requesting to renew a contract with Community Maternity Services for their transitional living program for parenting and pregnant young women ages 16 to 22. This is up to $300,000 and 100% federally reimbursable, sole source, a unique service provided in the county.
Great, 100% payment by the federal government. Do I hear any concerns or questions? Any complaints? Do I hear a motion? Motion's made. Second, all in favor?
Aye.
Any opposition, hearing none, it's unanimous. Michelle, once again, authorizing the renewal of contracts with 4 providers of home establishment furnishings.
Yes, we're requesting authorization to renew agreements with 4 providers for furnishings and other things to establish homes for those people that have lost their home, who have come out of a residential program, who have had a fire maybe, or generally homeless. We're required to contract with ready and able providers, and there's set fees on how much we're able to reimburse for different products, and you can see in the RLA some samples of things that people might buy to establish a new home and to get into a new apartment or other housing, often when people have absolutely nothing except the clothes on their back sometimes.
These are all contractors we've used in prior years, right?
Yes.
These 4, okay.
Wait a minute, is there one new one? Yes.
Yeah, one new one.
Where is it? Is it the Bass? The Bass
Bass
Company. is
on
new.
Broadway?
Yeah, and we are required to only contract for new furnishings. We're not allowed to buy
No
used
use.
furnishings.
Secondhand.
All right,
Yes, so.
that's what I was gonna ask.
Your questions still hanging, Mr. Bullock?
No.
Okay,
she
so I'm
answered.
satisfied.
Thank you.
Okay. Do I hear a motion? Motion's made, seconded, all in favor?
Aye.
Any opposition? Hearing none, practice approval. Thank you very much, Commissioner, for coming down. There's Commissioner Gale. Okay.
I took a bath this
I'll leave that for you, Gail.
Don't worry.
Mike, you're on the man.
Sorry.
Yeah, that's okay. Just let it loose. That's all right, Gail. Good evening, ladies.
We need some
Okay,
salt.
we'll take you to number 4. Authorizing agreement with various Albany County municipalities for the provisions of Youth Bureau services. Gail.
Yes, good evening, everyone. So we're requesting authorization to enter into contractual agreements with the various Albany County municipalities for the Youth Bureau funding that is allocated through the Office of Children and Family Services. These fundings go to the various municipalities to support youth development programs. And so listed out are the municipalities and the allocations that have been recommended for the various municipalities to support the programs that they provide in their jurisdictions.
Great. Mr. Bullock?
I noticed in
That's
the
okay.
backup that the city of Albany is getting less than the town of Colony, quite a significant amount. Why is that?
That's also based on what is requested from the municipalities. And so depending on what they submit in their applications and the amount that is requested, that is taken into consideration.
This is going to be a question, yeah.
So the Albany didn't request it, you're saying, okay.
Are there any more questions? No more comments? Prepared to vote? Do I hear a motion?
So
Motion's
moved.
been made and it's been second. All in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 5, authorizing an agreement with Cornell Cooperative Extension for the provisions of Youth Bureau services. Again, Gail.
Yes, thank you. So this is interrelated with the previous RLA. It is again requesting authorization to enter into a contractual arrangement with Cornell Cooperative Extension to support 4-H programming during the summer. And it's the same Youth Bureau state aid allocations because of the uniqueness of Cornell as a quasi-municipality. We also wanted to bring this forward.
Any questions? Any concerns? Do I hear a motion? Motion's made. Seconded. All in favor?
Aye.
Any opposition? Hearing none, that's approved. Item number 6, amended the 2017 Division of Children, Youth, and Family Services budget. Gail.
Okay, again, interrelated to the previous 2 RLAs. When we received our allocations from the Office of Children and Family Services for our Youth Bureau, it was higher than what was anticipated and what was approved in the 2017 budget. So we're looking to have approval to amend our 2017 budget for the additional $91,329 that we received in Youth Bureau funding from OCFS.
Motion, Paul.
Just a question, Commissioner. If you got $91,000 more than you had budgeted, did you use that money programmatically?
Oh, absolutely.
So what's the mechanism by which you do that?
So
Have we
we-
done budget transfers or do you have the ability to just allocate it between programs? How does that work?
So it's interesting, the timing of it. By the time we get notice of the funding that we're going to be getting from the Youth Bureau allocations, we're actually already into the midpoint of the year because it's dependent on the executive budget, which is passed April 1st or
Maybe.
thereabouts.
Maybe.
And so, once we receive that, then the Youth Bureau Advisory Board will come together. We have programs that we have historically funded. We'll look at how much money that we've received. And then based on that allocations, there's monies that are allocated from municipalities, and then there's monies that are able to go to support other community-based organizations. So once we have that total amount, we're able to look at those allocations. So the timing of it allows that even though this 91,000 came in at the midpoint of the year, we still had not made the final determinations in terms of the programs that were going to be funded. It's almost a retroactive funding, if you will. The programs that we fund know that they're really in a position of having to be able to support those programs until we're able to get the allegations and then reimburse their claims.
Okay. Does this then hopefully become part of a base for next year?
We are always hoping that we're at least able to sustain the same level of funding, or if not, even increase. And so far, we've been fortunate that we have been able to at least have flat funding or increased funding. This is actually representative of an increase.
Is it based on the census of services, so you have an upscale census and you have more need, or is it just per capita funds available?
It's how the state determines the allocations. Unfortunately, we don't have a lot of say in that. It
Well,
would
no,
just-
I mean,
Right,
bank
yeah.
error in your favor, collect 91,000. But is it,
I don't know, I could look into it and I could.
I'm
research
just
that
curious
for you.
whether or not that becomes a
It has
recurring.
remained flat for, I think, last 2 or 3 years.
Right, but we've been within this area.
And in the past, the state has said, make sure to use your allocation, because if you don't use it, you lose it type thing. Now, we've always used the entire thing, and there's really never been direct confirmation of that, but that's generally the philosophy that's
Okay,
used.
Thank you. Satisfied, Paul?
Yes, absolutely.
Any more questions, concerns? I hear a motion. Motion's made and second, all in favor?
Aye.
Opposition, we hear none. Unanimous. Authorizing the renewal of a contract agreement with the State University of Albany for the provision of management training.
Yes, thank you. So we're requesting authorization to enter into what will be a renewal contract with the University at Albany to continue to provide leadership and management training for our staff. We have a leadership and management team that consists of about 40 supervisors and managers. And so really to be able to continue to build their skill sets, give them the tools and resources that they need in order to be as effective in their roles as possible, we'd like to continue this contractual agreement with SUNY to continue to facilitate those trainings.
Gail, is this somewhat similar to the program we had? I think it was last month we talked about some training. It was a $48,000 program. Maybe you remember, Michael, because you weren't here, but you probably know about it.
So the last,
Training program.
forgive me, I actually was away, but
$48,000.
let me try and remember. So the last contract will incorporate, this is like a complimentary contract.
Oh, okay.
They've actually been doing this contract longer than we've been doing
Okay.
that, so that's why they're kind of split.
Yeah.
And also that contract is the whole county,
Okay.
whereas this is specific to DCYF. So they're all related, what department or what?
Human Services, you had 5 departments, 23.
This is school social work, right, the other contract's with the Center for Human Services Research,
Human
so
Services
related
Research
but different.
Foundation. Okay. Are there any more questions or concerns about this contract? I hear a motion, in a second, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 8, Gail, authorizing the renewal of a grant agreement with the New York State Office of Children Family Services for the Children's Advocacy Center, Child Fatality Review Team, and amending the 2017 Department for Children, Youth, and Families budget.
Yes, thank you. And so this RLA is to request authorization to accept the funding that goes to support our child fatality review team at the Children's Advocacy Center. And the purpose of the child fatality review team is really to come together and look at fatalities that have occurred and really review if there are any systems changes that can be made, what information can be learned from that in order to, with the goal of preventing future fatalities as well as enhancing children's safety. And it's a meeting of members across different systems, including child welfare, law enforcement, the medical, really coming together and really using the expertise in the various fields to really be able to look at making recommendations as to how to improve upon safety for children. Some of the areas that we focused on is unsafe sleep because, we look at that as a preventable fatality in terms of if we're practicing safe sleep. The goal is to mitigate deaths that occur to unsafe sleep practices. We also focus on, especially in the summer months, bicycle safety, pool safety, and we're looking to do this not only in the arena of when the various systems come together for the meetings, but also going out into the community and providing education and training as well.
Any questions or concerns? Do I hear a motion? Motion's been made. Do I hear a second? A second, all in favor?
Aye.
Any opposition? Hearing none, unanimous. Number 9, authorizing agreement with the Samaritan Shelter, Inc. for the provision of non-secure detention services.
Yes, thank you. So we're requesting authorization to enter into a contract with Samaritan, and this is the first of the 2 renewal options that we have on this contract. And it's to continue to provide services for juveniles ages 7 to 17 who are either PINs or JDs that, based on their circumstances, are in need of non-secure detention. Samaritan has been the contracted provider for these services for a number of years, and it's been a good collaboration in terms of meeting the needs for those youths who have been remanded to their facility, and looking at ways to be able to reintegrate them back into the community and working collaboratively towards that end.
Okay. A question?
Commissioner, I might have missed it in here, but do you know how many youth were served with Samaritan through this last year?
Oh, I can tell you our numbers went up.
Yeah.
Our bed days went up. I don't have the specific numbers, but I can certainly get them to you, but I can definitely tell you our numbers. You know, we have been doing a lot of work with the JDI initiative, the Juvenile Detention Alternatives Initiative, and working with the Capital Region Youth Justice Team, and you know, we had been trending down, I will say, in terms of our numbers, but unfortunately, over the last year, we have started to see a slight increase in terms of the youth that are being remanded either to non-secured or secured. So I can get you the specifics on that.
And do we have an average stay? Is that gone down, hopefully?
We would have the data for that, and I can get you that in terms of what that looks like.
Thank you.
I will tell you that one of the main drivers of the increase is actually runaways and girls.
Yeah,
Girls.
that's what I was kind of wondering.
Yeah.
Okay, Paul.
Just a quick question, Commissioner. It's a sort of a structural question. I see the the cost of the program is 49% state, 51% county. Is this a mandated program? That's a little if it's mandated, is it unusual that the county ends up paying a larger share?
Not unusual.
In fact, that's not a bad reimbursement rate. Safety net and social services is 71% county.
So this is, the entire program is mandated, we don't have any add-ons. So this is since it's state money, 49%, this is a state mandate?
Yes.
I'm not suggesting it's not a
Right,
good
no.
program, I'm just trying to understand why some have the
Because they
reimbursement
can.
rates they have and others don't, yeah.
It's ridiculous. They mandate things that don't help pay for them. Or very little.
Thank you,
Okay.
Madam Chair.
Do I hear a vote?
I'll make a motion.
Approved, second. All in favor?
Aye.
Any opposition? Hearing none, unanimous. Authorizing the renewal of an interdepartmental agreement between the Department for Children, Youth, and Families and the County Probation Department.
Yes, thank you. So DCYF works collaboratively with the Albany County Department of Probation in terms of the provision of services for those youths that are interfacing with the juvenile justice system. And so, because the goal is to be able to provide services and programs which hopefully will result in the kids not penetrating the juvenile justice systems any further, we contract with probation for the provision of services such as the Juvenile Community Accountability Board, which allows for those youth that are facing charges that rather than having to go into detention or some sort of restrictive programming, they're able to do restitution within the community. So programs such as that, or the JRES program, or the Juvenile Family Reporting Center, those are programs that are able to look at more ways to be able to do community-based intervention as opposed to using more formal systems. And because of, interestingly enough, the reimbursement that we're able to get through providing these services, we're able to support the probation in offering those programs.
Okay. Are there any other questions from anyone?
Make a motion.
You make a motion, the motion's been made, do I hear a second? And it's seconded, all in favor? Any opposition? Hearing none, it's unanimous. Okay, number 11, authorizing agreement, interdepartmental agreement with the Departments for Children, Youth, and Family Services and the Albany County Crime Victims and Sexual Violence Center, and amending the 2017 budget for both the Department of Children, Youth, and Families and the Albany County Crime Victims and Sexual Violence Center.
Yes, so the Safe Harbor Initiative is focused on commercially and sexually exploited children and really being able to provide education to the community, build awareness, and be able to provide intervention programs and services for youths that may have actually been identified as being trafficked or at potentially high risk of being trafficked. And so as we look at how to further develop our programs and services, we recognize that one of the areas that we could increase our effectiveness is having a 24/7 availability, that in terms of if there's a youth that comes to, say, a law enforcement department or to a hospital at 3 a.m., that there's still the ability to reach out and connect with someone to access services for a trafficked youth. And so that's where Crime Victims comes in. They have an established 24/7 response system. And so being able to collaborate with them, we collaborate in other areas with them. So we have a good understanding of our programs, we have a good understanding of theirs. So it seemed a natural fit to be able to collaborate in this manner in terms of filling that gap for the CSEC population. So in addition to being able to provide that 24/7 response, they would also be able to be a facilitator of referrals for services and providing follow-up as needed for any of those youths that may be identified as being trafficked victims. So we're excited about the potential of being able to continue to complement the programs and services with this collaboration.
Okay. Any questions? Any concerns?
I make a motion.
The motion's been made, is there a second? Second, all in favor? Any opposition? Hearing none. It's only a $10,000 collaboration, that's good. Thank you, Gail. The next one up is the Albany County Department of Aging. Okay. Oh, we have distinguished attorney, Mr. Scott Single here. Good evening, sir.
Good evening, how are you?
Very good. Okay, item number 12, authorizing agreement with the New York State Office for Aging regarding the home delivered meals program.
Thank you, Madam Chair. First one is our 3C2 funding. All these tonight, by the way, there's 5, all for federal, to accept our federal grant funding.
Okay.
First one being our home delivered meal program. No changes that I'm aware of anyway to the program. There's, of course, 10% county match.
Okay. Any questions?
I make a motion.
Motion's been made, the second? The second, all in favor? Any opposition? Hearing none, it's unanimous. Number 13, authorizing agreement with the New York State Office of Aging regarding the congregate meals program.
Pretty much the same story,
Same as
except
before?
instead of having it
renew.
delivered, you have to go somewhere and eat.
Renew, redo.
I make a motion.
Motion's been made, seconded, all in favor? Any opposition? Hearing none, it's unanimous. Number 14, authorizing agreement with the New York State Office for the Aging regarding the provisions of supportive services for seniors in Albany County.
Thank you. This is our Title IIIB funding. This covers a vast array of services for senior citizens. Here, we tend to focus the lion's share of that funding towards our adult day services, in-home contact and support, which is your friendly visits, shopping trips, things of that nature.
Okay.
Legal aid and transportation are the big ones for that.
Okay. Do I hear motion?
I'll make a motion.
Motion's been made. Do I hear second? It's been seconded. All in favor? Aye. Any opposition? Hearing none, it's unanimous. Number 15, authorizing agreement with the New York State Office of the Aging regarding the Elder Caregiver Support Program.
Thank you. Title IIIE is our caregiver support, provides respite for caregivers who are over the age of 60 to get a little reprieve from being a full-time caregiver.
Do you have the application here from me?
I certainly know where you can get one.
I appreciate that, thank you. Do I hear a motion? Motion's made. Oh, and a second. Second here, all in favor, it's unanimous. Okay. Number 16 and the final one, authorizing the submission of a community development block grant application to the New York State Office of Homes and Community Renewals for the Albany County Senior Housing Rehabilitation Program.
Thank you very much. You may recall, we started this a couple of years ago. We applied for a community development block grant through HUD and was awarded the full amount. Very successful program, recently just closed that out in June. Even HUD is impressed with the way that we did that, which is a credit to all of us. And encouraged us to apply again now that the new round is open. They've upped the amount to $850,000, which is always a good sign. And there is no county match for this.
Okay, that sounds good.
Question?
I got a question on this? Okay.
You have 75 people on the waiting list as we're waiting for this money to come, right?
Yes.
Is that increase gonna cover those people, do you think, or?
There's no way
No
we're gonna
way.
be able to get to all 75. 750 covered 29.
Oh,
Wow.
okay, okay.
So
How
we
much-
wanna get as many people as we possibly can. The good news with this is that we now have a track record.
Yeah.
There minus changes at the federal level to this program. We're pretty much a shoo-in for this funding as long as we keep going the way we're going.
Yeah.
Which I personally am very confident about that.
Good, good.
That sounds real good. Any more motion? Oh, Mr. Bullock, go ahead.
What's the maximum you'll do on making a home repair? I mean, is there some line you draw where this is unrepairable, the home?
Well, that would be up to codes, really. I mean, every home before it's worked on has to be inspected. And the inspector will go in and determine what needs to be done in terms of having a senior citizen be able to stay in their home comfortably, but also what needs to absolutely be done in order to make the home livable for anybody. So if there's a shoddy roof or a cracked foundation or something, that's gonna take priority. Most of these projects average between 20 and 30,000 is the average.
That's what I figured.
People are getting, it's a very popular program. We've gotten lots of good feedback about this, something we're very proud of. We'd like to keep it going, help as many people as we can.
I agree.
Paul, you got a question?
You just said the average grant was between 20 and 30,000.
That is correct.
I'm sitting, color me confused. On page 3, it says funding limits. The maximum amount is 150,000 with a dwelling unit maximum of 25,000. The minimum award amount is 75,000.
That is for the Access to Home for Veterans program. I apologize, what I included in the backup is all of the, it was all in one package.
Okay, so.
Actually, if I direct you to page 1,
Okay, we're only to look at page 1.
where it says the New York State Community Development Block Grant Program,
Thank you.
and it's got the maximum amount towards the bottom for counties of 850,000. There is no cap on how much we are allowed to spend on one home. But going back and forth, we kind of determined internally that we could justify between 20,000 per home. 20,
And you do,
30,000.
these are means tested homes, with income, eligibility and all above.
Oh, yes, there's
Okay.
lots of requirements.
Yeah, you just went over them.
All right. Paul, did you have a question?
No, that was.
That was good, you followed?
I'm fine.
Okay, do I hear a motion? Motion's made, and second? All in favor?
Aye.
No oppositions, 100% approved. The final one is authorizing an agreement with the New York State Office for the Aging regarding the medication management program.
Thank you very much.
17.
This is our Title 3D, generally referred to as our health promotion and disease prevention funds. There's not a ton of it. Generally, this goes to pay for our Tai Chi programs that we offer. This year, we're going to start a new one called Stress Busters, which we're kind of excited to see how that goes. That's more for caregivers, for senior citizens. and, pretty much it.
Sounds good. Are there any more questions?
I'll make a motion.
Motion's been made.
Second.
It's been second, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous.
Thank you all
Thank you very much, Mr. Siegel. Okay, no, a motion to move, to adjourn, I mean.
Whatever.
To move to, you can move and adjourn, move out of here. Thank, okay.